Welcome, everyone. Welcome to today's edition of The Conversation. And with us, we have Dr. Lester Pereira. Welcome, Doctor.
Hi. Thanks a lot.
Thank you so much for joining in. I don't know where to begin in terms of introducing you. So, I think it's best that you introduce yourself for the sake of our audience.
Yeah, so hi everyone. I'm Dr. Lester Pereira, and I'm an orthopedic surgeon. I'm currently practicing at Kalyan, and the main focus of my practice mainly revolves around arthroscopy, sports medicine. Although I do practice general orthopedics, that is, I do deal with a lot of trauma. I do have a lot of replacements, that is, hip, knee, shoulder replacements. But my main focus is on arthroscopy, sports medicine. So I work with a lot of sportsmen, a lot of young athletes. So yeah, that is the bulk of where my work lies.
Very interesting. Doctor, the first question that hits me when you talk about your background is
Mhm.
why orthopedics as a career? I mean, when we talk about medical science or being a doctor, of course, there are multiple variations available. But what made you choose orthopedics, and when did you feel that this is something which I would love to do?
Yeah, so the thing is, I always knew I wanted to be a doctor. I mean, that is where my calling always was. Like right from my college days, I knew that I was gravitating towards medicine. And then through my MBBS and after I started working post graduation, I think the reason I was drawn towards orthopedics is because I have this mechanical bend towards the way I function, and I'm always interested in mechanics. So orthopedics is the one field in medicine where there's a very good balance between medicine per se, and also there's a lot of mechanics involved. There's a lot of engineering. So I think that is why I was drawn towards orthopedics, and I was lucky enough to get orthopedics and find the right mentors, find the right trainers, and I'm just loving it.
Interesting. So in a nutshell, I think it's a good culmination of both science in terms of being a doctor as well as being an engineer in some way.
Yes, absolutely.
Perfect. Take us through your experience of being a doctor. Now, how many years have you been practicing?
I think it's over 10 years now since
Okay.
I'm practicing.
All right. And
Yeah,
in
so
your
it's been a while.
practice, I see. And in your practice, when you happen to meet patients from different walks of life, and you spoke specifically about your expertise in sports, uh, tell us a bit
Mhm.
more about that.
Yeah, so since you mentioned, meeting patients from different walks of life, the thing is, I've worked in multiple states in India. So I've worked in Delhi. Most of my training was in Delhi. I worked in Gujarat for a bit, in Bombay for sure. I have also worked in Malaysia. I've done some work in the UK. So what I've learned from working in different, and apart from that, I've also worked in different sectors, like in different healthcare systems. Like I've worked in the private healthcare system. I've worked in government setups in India, and then also everything that lies in between. Like charitable hospitals and so on and so forth. So having this varied experience has made me realize that uh, healthcare is not just about the science. It's not just about what you can deliver to patients. It's also a lot of it is also understanding the society where you have to serve, and understanding what people expect, because what a patient in Bombay expects out of you is very different from what a patient in some interior part of the country might expect from you. And having that understanding of what the patients want from you, I think is the key to being able to deliver satisfactory healthcare, I would say.
Interesting. Is there a process that you tend to follow in terms of understanding what the patient is expecting from you? I mean, is there a way to do that?
So the problem, I would say, or rather the unfortunate part of practicing in our current setup, is that we don't get much time with our
Mm.
patients. Like I for an ideal consultation, like when you come to me, let's say you come to me for a consultation. Ideally, for me to firstly get you comfortable, and for me to get you comfortable to the extent where you're able to open up and actually tell me what you're expecting out of this consultation, it takes a minimum of 20 minutes, I would say, or half an hour. to say the least. And the problem is that we are not always able to give that much of time to each patient because of the sheer volume of, because of the sheer numbers of patients we see every day. But yeah, but there are tricks and there are ways, and also, I mean, with experience, you kind of tend to gauge what the patient expects out of you, like right from the time they walk into your clinic, and once they sit down and they start talking. I mean, with experience, we have kind of developed that understanding of how patients are able to. I mean, based on how they speak and what they say, I mean, to some extent, we understand what they're expecting out of us. And then obviously there are some leading questions where you try to get them talking, get them comfortable, and then ask them. Like it's an upfront question. Like not everyone wants the same thing. Not everyone wants to. Sometimes people just want to get alleviated from their current discomfort, and that is all. They don't want to get into extensive evaluation, and they don't want to get into elaborate treatment protocols and all that, which is fair enough. It might not be ideal, but if that is what they want, you should be able to give that to them.
Yeah, absolutely. So when you probe patients about what do they expect from you, or you're trying to understand what kind of challenges are they facing right now, what are some of your observations during this conversation? I mean, do you think people directly talk about the problems? Do they really know what problems they're facing? Or sometimes they might assume something, but the actual problem might be different?
Yeah, so what I've noticed is that what patients generally do is they the first observation is patients or the people in general come visit a doctor when they are in deep distress. So they try home remedies, and they try all kinds of other ways of elevating their discomfort, which is fair enough. I mean, if you can do something like that, and you're getting relief from your symptoms, you should absolutely do it. But the time they come to the doctor is when things have already escalated to a certain extent, and then they expect quick fixes, which is not always possible. So I try to take the time to explain to them that this is not something where we can give you a set of medicines. You take those medicines and you'll be fine. So this is something where we need to work. And most of the time, most of the orthopedic problems, especially in geriatric patients, is multifactorial. It's not just about popping some pills and getting okay. There are lots of things that you need to take care of. Other than medication, there is exercise. A lot of our patients have to lose weight to really get better. Mm, there are multiple other things involved. There's diet, of course. So I try to take the time. It's not always possible, but whenever I can, I try to take the time to explain to my patients that there are multiple things you need to work on.
That's an interesting point that you make because, generally what we see today is everyone is addicted to quick fix. Everyone wants instant gratification, right? So if I'm having a
Absolutely,
pain,
absolutely.
if I'm having a pain, I want to get rid of that pain as quickly as possible. Whereas there are certain, situations where you need to give time for the injury to recuperate. So whether it's
Absolutely.
exercise or following a diet or following a basic lifestyle, how easy or how difficult it has been for you to try and convince people to take the longer route but the right route? What's been your observation there?
So it's actually difficult. I think the problem with our current generation is that we are this whole instant gratification thing. This has just been embedded into our psyche. I don't think we can function anymore, where we take the time to realize that there are certain things we need to do and we're going to have good results long term. I don't think people have the patience anymore. So it is very difficult. But I think you need to do that repeatedly, like keep banging the point in, keep trying to remind your patients that this is we are not looking for short-term goals here. We're looking for some permanent solutions, and permanent solutions take time and they take effort. And yeah, eventually somewhere down the line, most of my patients do get that, and then they fall in line and they start following my advice.
So you try your best to convince people to take the long route.
Yeah, yeah,
Sometimes, and I completely agree with you. I think a lot of people would want to get rid of their problems quickly. And I understand to a certain extent because if you're under sheer pain, who would want to persist with that pain for a long time? But the fact is,
exactly.
if you want to get rid of the root cause of the pain, then you need to do certain things over a longer period of time. And I think a lot of people find it difficult to give it that longer rope. because they just want to pop a pill or take an injection and feel great about it.
Hmm. Exactly.
So, in your observation, because you've said you worked in India, you worked in Malaysia, and several other countries, including the UK as well, have you seen any commonalities or perhaps any differences working with patients from different geographies? I mean, let's talk about India particularly to begin with. Do you see Indian patients have a different set of problems as compared to people outside, or more or less it's similar?
No, not really. I think the general what do you say, the general prevalence of pathologies, diseases is pretty much the same. There definitely is a variation based on, I mean, there's racial differentiation for sure, like Indians, Asians for that matter. We have a different set of problems. Like for example, arthritis in our country, I think starts on earlier, and especially in women in India. The prevalence of arthritis is osteoarthritis, that is far much greater. Uh, the other aspect is in the Western world, people seek medical care early on. So they tend to present to you when the disease is still developing. So the options of treatment are much more varied. There's a lot you can do. As opposed to that, in India, when patients present, by the time they present to you, they are already in the advanced stage of their disease, whatever it might be. Especially in terms of, I mean, if you talk about knee osteoarthritis, which is one of the most common reasons why anyone would go to an orthopedic surgeon. So in India, once the patient comes to you, they're already at a very advanced stage of the disease. So your treatment options are then very limited. So that is the one stark difference that I've noticed.
So, what I understand from you is people maybe based out of the UK or in the West are slightly more proactive. I think that also goes to the overall health awareness that is there in the country, because of which people come to you at an earlier stage and seek your advice on what they could do to rectify the problem. Whereas in India, in fact, as you use the word arthritis, I remember having heard this word when I was back in school, but now it has become so common. I mean, you think of people who are in their late 60s having arthritis, but I think it's turning the other way around, isn't it? I mean, you have a lot of youngsters, in fact, who are suffering from many of these problems. So, what do you think is actually contributing to this challenge, especially in the Indian context, that a lot of people are now suffering from this disease or are having problems around it?
So see, the thing is, arthritis again is it's not one single disease. There are multiple arthritis. There are multiple arthritis is basically destruction of a joint. So there are multiple very different types of arthritis, and arthritis seen in younger people or at a younger age is of a different kind. They're more of the inflammatory kind. Uh, Osteoarthritis, which is mainly the arthritis that we see as we age, generally presents somewhere in your 60s or so. Now the reason Indians tend to be more symptomatic and tend to have more joint destruction. First, the reason for that is firstly there's a lack of exercise. Like middle-aged Indians don't exercise a lot, in the sense they don't engage in a very few of them would engage in sporting activities. A very few of them walk regularly or do some kind of weight training. So there's a lack of exercise. Because of that, their muscle bulk is low, their strength is low, so they are more prone for their arthritis to develop to the extent that they start having symptoms. They start having constant pain. Secondly, our diet. Indian diet is carb loaded. The traditional Indian diet doesn't have a lot of protein. So that is another thing that contributes to bone health, muscle health. So for these two reasons, I feel the disease burden in arthritis in middle-aged Indians is much, much higher. And second, and most importantly, the awareness factor, like if someone has knee pain at 40, ideally you should go get it checked. You should try and understand what is going on, and you should try and understand what do you need to do to fix it. And most of the time, these are just very simple lifestyle changes you need to make. You need to start exercising. You need to start following up regularly with your doctor. And if you do all of that, in most cases, you might not be able to stop the arthritis, but you tend to you'll definitely be able to slow down the progression of a disease, which a lot of people don't do in their 40s and early 50s. And that is why by the time they're 60, by the time they come to us, they're already at a stage where we have already missed out, on the simpler and early treatment options that we have.
Yeah, well said. So, two essential areas that you spoke about, and I think a lot of us are guilty of not being able to adhere to those two. One is the food, and the other is the exercise. I mean, we Indians
Yeah.
love our food, isn't it? And as you said, our food is carb loaded. But the question I have is, can we really make a monumental shift in the kind of diet we practice, which will ensure that we don't fall victim to arthritis, at least not fall victim to it too early in our life? So is there anything that you normally recommend people, both who are your patients and people, for them to generally stay fit?
See, the thing with diet is, especially in India, where diet is not. I mean, the food we eat is not just. There's a lot of it. I mean, it's very culturally linked. As you said, we love our food. There's a lot of emotion involved with food, and it's a big. And the thing is, people in their 40s, 50s, even 60s, most of them are set in their ways. It's very hard to change habits, and eating is a habit in India. So it's very hard to change people's habits once they're of the age of 50 or 60 or so. So generally, I don't advise my patients to make any drastic changes, in terms of their diet, because I know that most of it won't work. Most of them won't be able to do that. So I just ask them to do simpler things. Like I just ask them to start increasing their protein content. So I ask them to speak to a dietitian, or even look up on the internet, which is something that people would do more willingly. Look up on the internet, and among the things that you already eat, the things that you already eat regularly, which are already part of your diet, just see what among those have a higher protein content, and then try and increase the bulk of that in your diet. And once you do that, once you increase your protein content, I think to a great extent your carb requirement and the amount of carbs that you intake over the time starts diminishing. I mean, and that's an easy thing that people would follow, and I think over the time it kind of balances out.
Yeah, absolutely. So you mentioned about protein. Now, there is a lot of confusion around what kind of specific food that we need to ensure that can provide us with the required dosage of protein in our body. So vegetarians have a different philosophy, non-vegetarians have a different philosophy, and there are so many arguments happening between the two groups saying that our food is much better than yours. What's your take on this? I mean, how do you simplify your meal so that there is sufficient intake of protein, irrespective of what kind of diet you follow, whether it's vegetarian or non-vegetarian?
Yeah, so again, I don't think being vegetarian or non-vegetarian has a great. I mean, you shouldn't, like, the point I'm trying to make is that your protein intake shouldn't suffer just because you're vegetarian, because we do have a lot of protein-rich vegetarian sources of food. Like, so it is just ultimately it just comes down to knowing what you eat, which a lot of us don't really think about. When we eat, we think about what tastes good, or what we like to eat, or what is just part of our routine or our cultural habits. What I try to encourage patients to do is to start reading and start knowing what you're eating, and start reading about the nutritional value of the things that you generally consume. So the point I'm trying to make is, generally what I've noticed. This is my personal experience. I don't know. Maybe if you speak to a dietitian who works more extensively or more in detail in terms of altering people's diets and giving dietary advice, they would have a different take on it. But in my experience, when you ask people in their 40s and 50s, as I said, that age group, people generally are not willing to make drastic changes in their dietary habits. They just won't. So you have to find a way out, find the middle path, where you just ask them to start reading about, or reading, or just talking to someone, or trying to find out what is the nutritional value of what they're eating. And once they start understanding that, gradually, eventually, they start making the changes.
So, would you essentially say that rather than going for a generic assumption about what to eat, what not to eat, it would make sense if people seek help from a dietitian or a nutritionist who can give them a clear mandate of what to eat, what not to eat, depending on their habits and depending on their
Absolutely.
preferences. Would that be a better choice for people to make?
Absolutely, absolutely, definitely. See, and the thing is, you know, like for example, in Bombay itself, we have people who have migrated from different parts of the country, and people have their own specific, ways, eating habits. The They have a specific, cuisine. So blanket recommendations generally don't work in a very diverse culture like ours, So I think taking the time, again, it's about taking the time, talking to a dietitian. The dietitian then takes the time to understand what is your diet already, what your diet already exists of, and then that is when they can work things out. So the idea in terms of dietary recommendations, I think, is to try and make it as simple as possible, number one. And number two is to try and make adjustments. I mean, try and increase the nutritional value of your food by making minimal changes. So if you make a lot of changes, generally people tend not to follow them for long. If you want your patients to follow a certain diet plan and to maintain that in the long term, you have to make changes which are minimal and which are easy for the patient to follow. And that takes time, again, as I said. So in a 20-minute, if I'm spending 20 minutes with my patient, I have to first get the history. I have to look at their complaints. I have to physically examine the patient, prescribe medications, explain the treatment plan. And then I don't think I have enough time to take their dietary history, understand their diet, give them nutritional advice. So my advice in terms of diet is just a very generalized, a generalized advice, but I definitely recommend that they should see a dietitian and get proper advice in terms of the diet.
So what I understand is, doctor, you are not recommending too many changes as far as diet are concerned. Maybe one or two key areas that you identify could help the patient potentially. And then you also guide the patient to seek help from a nutritionist who could go deeper and deeper, understand more about the food preferences, and accordingly recommend what would be a better choice.
Exactly. And the same applies to exercise, like in terms of lifestyle changes and exercise. I generally don't ask, again, no, I don't believe in blanket advices where you have one certain protocol which you ask all your patients to do, because they simply won't follow it. So again, in terms of exercise, the first thing I do is I ask them, what do you already do? Like in the entirety of your day, what is your physical activity maybe entail? Maybe for someone it might be going to the market in the evening. So what I ask them to do is, when you go to shop, when you go to buy a grocery in the market, what you can do is try and take an extra round. Go see if there's a park around. Try and take a few rounds, then go and buy your groceries. Or if someone goes for a morning walk, I ask them to increase the steps that they take in their morning walk. So I feel that if you work with habits and with the routine that patients already have, and you try to build up on that kind of has better results. Patients tend to follow that a lot easier, as opposed to asking someone to start doing a new activity and all, which maybe, again, you have to gauge how motivated your patient is. There are some patients who are very motivated. They come to you and they say, I want to do, I want to make a drastic change in my health, and I'm motivated and I want to do whatever it takes. Then yes, when you sense your patient is motivated enough to do all that, then you can give them all the recommendations that are available. But in most of our patients who are not, you know I mean, this is something you gauge when you sit in front of a person and talk to them. And if you see that there is a lack of motivation, then you have to work with these kind of things.
Yeah. So, when you spoke about exercise and you referred to walking, I've met a lot of people when you ask them what kind of exercises do you perform, the only answer that you get is, oh, I've been doing walking for about 15 years now. And that's pretty much
Hmm.
about it. But there is a class of doctors, experts, nutritionists, dietitian, and if you ask them, they say, although walking is a great exercise, it is necessary, but by no means it is sufficient. You need a mix of multiple exercises to ensure overall holistic health. And if I may use the word, a lot of doctors have been referring to sarcopenia, which is post 40, you tend to lose a lot of your muscle mass. So given
Okay.
that, how do you give people a reality check? What do you recommend for people to therefore do on a consistent basis, which will at least make sure that your flexibility, your movement is not restricted even as you age?
Yeah. So it's fun. It's funny, when you like the prototype patient in an orthopedic clinic, a 55, 60-year-old female, who's maybe a housewife, uh, who's come to you with complaints of knee pain. And then after you've had a discussion with her, you say that, you need to start exercising. Like amongst all these things that I've recommended, like which includes medication, which includes maybe physiotherapy, which includes some kind of activity modification. I tell them among all these things that I've told you, the most important of all this is exercise. You have to exercise. And this is the standard response that I get from probably 90% of my patients. They say that, I'm on my feet the whole day. I wake up in the morning at 7, I make breakfast for my entire family. Then I go get some groceries. Then again, I'm preparing lunch. And by the time it's 10 at night and I'm done by the day, I don't have any strength. So I'm getting enough of exercise. So I don't think that that is a problem. So this is kind of the misconception that people have, that just because you're on your feet the whole day and you're tired at the end of the day, that doesn't mean you're getting enough of exercise. And as you said, exercise, there are different kinds of exercise and they work differently in contributing towards your health. Now, walking in a way is amazing because of the fact that it's easy. Anyone can, I mean, it's the easiest thing to start with, number one. Secondly, people, especially geriatric patients who have multiple issues, walking is probably the simplest thing that they can do. So walking is something that we definitely recommend. For knee health specifically, walking is amazing. Even if patients are in severe pain, we ask them, as much as your pain permits, walk. Don't stop walking, because that is the one thing that will keep your knees mobile, that will get your calf muscles pumping, and that will maintain some amount of muscle tone, muscle bulk. Now, apart from that, so walking is basically, I say, the bare minimum that you should do, that everyone has to do. But then you move on to the next step, and weight training is something which has shown to have massive benefits in maintaining muscle mass, maintaining bone health, bone density, and that is something which is lacking in our Indian lifestyle. We don't culturally have that, uh, this habit of doing weight training exercise. It might not necessarily be going to the gym and lifting heavy weights and all. It can just be body weight exercise which you can do at home, but that kind of needs to change culturally for sure.
In fact, it's very essential for people to know that doing weight training does not mean you have to go to the gym. I think there is a lot of misconception
Exactly.
around that. Is the fact that, oh, I don't have a gym membership, or you know what, I tried gym in the past. I went there for a couple
Hmm.
of weeks and then I stopped. So it's not my cup of tea. So what do you think people should do? Maybe are there one or two things that they need to do on a day-to-day basis, especially post 40? Which will at least
Hmm.
take care that, yeah, along with walking, I'm doing some kind of strength training. Uh, it may not be complete strength training, but at least it takes care of my overall health. I don't want to have six-pack abs, but I want to make sure that I have enough agility and flexibility in my body as my age. So, are there a couple of exercises that you recommend people that they can practice as they age?
Yeah, so see, the thing is, as you age, the most important thing to maintain, the most important thing rather, for your musculoskeletal health per se, is to maintain your muscle bulk, and to maintain mobility in your joints. Yeah. So, one of the most important muscles that determines how your general health will function is your quadriceps. That is your thigh muscle. Okay, it to a great extent, the bulk or the strength of your thigh muscle will determine how your knees fare as you age. So, one simple exercise that anyone can do is squats. Now, squats doesn't I don't expect people who are of the age of 40 and 50 to do proper squats where they go all the way down and all. But you can do something like a half squat, where You sit on a chair and try to get off the chair. Not the entire squat where you bend, you go all the way down, but a half squat to begin with is amazing. Secondly, push-ups or what we know as the Surya Namaskar is a great exercise for upper body strength and core strength to begin with. So I think these are two very, very, very simple things which anyone can do to begin with. Uh, will do a great deal of benefit for their to maintain their muscle mass. And then the other aspect is flexibility. So there are two kind of these are like two ends of the spectrum. You need to maintain strength and you need to maintain mobility in your joints. If you're able to do that, I think 90% of orthopedic problems tend to be taken care of. So flexibility, that is stretching exercises, is something that can benefit a lot. Yoga per se is amazing in that aspect. Although yoga doesn't give you a lot of doesn't give you the benefits that strength training does or weight training does. But in terms of flexibility, yoga has a lot of benefits. So either do the traditional yoga or you can do simple stretching exercise. So these are a few simple things that anyone can start at home, irrespective of their age.
Yeah. Also, many times we have heard this statement that sitting is the new smoking. And especially for a lot of people who work in the corporate sector, uh, we are sitting together for hours at a stretch. Uh, and
Mhm.
sometimes people do get up and walk, but I think because of the sedentary lifestyle, you might walk maybe 30 minutes or an hour in a day's time, but during the course of the entire day, you're still sitting. So largely the body is not in action. So are there any simple stretching exercises that people could do while they are at work, or maybe they're busy with something else and they can combine this as part of their stretching regimen?
Yeah, so there are like you said, that sitting in the new smoking. So that is probably the one of the major reasons why we have all of our musculoskeletal problems that we see today. One is the sedentary lifestyle, and secondly, it's the lack of sun exposure. Like vitamin D deficiency is so common. It is common to the extent that you have to assume that everyone is vitamin D deficient in today's time. All of us are, to different extents. It's just that some of us have symptoms, most of us don't. But everyone, you can safely assume, is vitamin D deficient, unless you're actually someone who's consciously trying to get enough of sun exposure. So, as you said, for people who have desk jobs, who are sedentary, who spend most of the day sitting at a desk, uh, there are two main kind of set of problems that they come with. One is lower back pain, and secondly is neck pain. So there is something called ergonomics, where you try and understand your seating arrangement. Uh, so that so ergonomics basically, uh, to be aware of your seating posture, your arrangement. So in your office, for example, when you're sitting at a desk, uh, on your chair, there are multiple things that you should consider. Firstly, is the level at which your screen is. Like right now, the way my screen is kept is very unhealthy. Like I have to bend down to look at the screen, which is incorrect if you're doing this on for multiple hours a day, every day. Okay, so the screen should be roughly at your eye level so that you don't have to strain your neck to look at the screen. Secondly, your elbows should be well supported. The way your mouse is placed or your keypad is placed should also be in a way where you don't have to strain. You should not lean forward or lean back. You should have proper back support. You should have proper neck support. So these are a few things that, and all these recommendations are. I mean, you can just look it up online because they are specific, uh, to what your office setting is. So, but the thing is, you should be aware of this, and you should try and see that the thing is, in today's time, information is easily available. Like you can just Google search, ergonomics, or how my office setting should be, and you will find all the information. The problem is that most of the people don't are not aware that there is something of this sort exists, and this is important. So I think our job is to get people, increase awareness, basically, that these are things that you should look at. And these things do have an impact, especially if this is something you're doing for long hours in a day and you're doing it every day. So that is number one. Firstly, take care of the ergonomics of your workspace. Then, as you said, stretching. So the before stretching, the one thing that I would say is that if you are in a job which requires you sitting for long hours, you should make it a habit to get up every 45 minutes or half an hour, take a walk, take a stroll, and then come back to your seat. Sitting continuously for long hours is bad. It's really, that is one of the worst things that you would want to do for your spine. So number one is getting up frequently from your chair, taking a short stroll, coming back. In terms of stretching, there are a few neck stretches which you can do. Uh, Stretching it in each direction, like flexion, extension of your neck, lateral flexion, rotating your neck on either side. These are a few stretches that you can do. There are some isometric neck exercises where you can just use your hand as a resistance, and press again your hand. Do it on all four sides. These kind of get your neck muscles working, which ultimately are the muscles that function to maintain your posture. And then, of course, you can stretch your back. So these are few things that can be done. And what is good is a lot of workspaces right now are getting conscious about this, and they have breaks. A lot of places now have activities where they get their employees in certain time of the day. They have yoga sessions in the office spaces and all. So it is. I wouldn't say it's all that bad. I mean, we are getting more aware. People are getting more aware. Corporations as such are getting more aware because they have started to realize that having a healthy workforce is more financially viable. If your
Absolutely.
employees are healthy, if they're fit, that directly influences productivity. So even corporations are starting to realize that.
Very true. Very. So, doctor, you mentioned about ergonomics. A lot of times, people who are working from home uh, do
Mhm.
not think about ergonomics like the way an organization would think about its people, right? It's a much more scientifically designed workplace. So I make sure that
Exactly.
your laptop is placed at a certain height. I would make sure that you don't have to struggle when you're seated on your chair and things like that. But post-COVID era, most of us are working from a work from home environment or at least a hybrid environment. So, are there certain things that you believe people need to follow or practice, even when they're working from home, so that they don't go wrong here?
So I think one of the things which a lot of people, a lot of actually I've heard this from a lot of my patients is what they have started doing is they have started using firstly now there are multiple options available in the market. So you get adjustable desks like office tables, office desks, and your chairs, which have multiple levels of adjustment. Okay, so your desk can the height can be easily adjustable. Just it has a clamp which you can use. So having that is very important because it might be different for everyone. Like again, there is no one recommendation fits one size fits all kind of a recommendation in terms of ergonomics. And secondly, there are things that it works very differently for different people. So, but if you, the point I'm trying to make is right now there are products available in the market where you have office desks and office chairs which have adjustments that can be made. So having that is I think very important. And then it's about trial and error, and it's about seeing what works for you the best, what gives you best results in terms of elevating your pain if at all you have any in the long term. Secondly, what a lot of people have started doing is they started standing while working instead of sitting at the desk. They alternate between sitting down and working on a laptop, or they get a higher table where they stand and work for some time. And basically changing your seating area. Like you can shift to the couch for some time, come back to your desk, stand and work for a while. So it's about, I think it's especially when you're working from home, it's about not being stuck in one corner of the room or one space. It's about finding reasons and finding excuses to keep mobile, keep moving around. I think that helps a lot.
Yeah, so you got to
And
make sure that your
and
setup
sorry,
complements it.
sorry.
Yeah.
Yeah, so the thing is, I'm a big proponent of not working from home. So if anyone has the option of getting out of the house, going to your workplace, please do that.
Yeah, I'm not sure. I'm not sure a lot of people would vouch your sentiments on that, but unfortunately, a lot of people have gotten used to the habit of working from home, so there's not
Yeah.
much we can do about that. So, extending on this argument a bit more, uh, we know that seating or sitting in general has been a problem for many of us. But there are a lot of
Mhm.
jobs, a lot of professions, including people who are like homemakers or housewives, as we call them, or many times even men who work in the retail outlet or women who work in the retail outlet have to stand for a long time.
Yeah.
Is that also a cause of concern? Because we talk a lot about sitting and why we shouldn't do that, but we also have the other spectrum where people are standing for long hours. What can we do about that?
Yeah, so standing jobs that require standing for long hours have their own set of issues, especially patients who have varicosities, where the veins of your lower limb tend to get boggy and tend to accumulate blood. Uh, these are conditions where standing for long hours should be avoided as much as you can. I mean, we do recommend, although these are not conditions that I personally treat because these are more things that come into the domain of vascular surgeons and general
Mhm.
surgeons. But what we recommend patients who have jobs which require them to stand for long hours is firstly try and break that kind of cycle. I mean, try and change your posture, try and find a reason to walk around and not just stay stationary or stay standing. Uh, Number one. Number two, there are stockings that we advise patients, especially ones who are symptomatic and have developed varicosities. So yeah, these are few things. But the problem is in a lot of our job, uh, in a lot of industries, uh, your employer is not always considerate or doesn't always value having all these health
Mm.
recommendations and so on. So it's tricky actually to work with, but there are a few simple things, as I said, if you are in a job which requires prolonged standing, try and find reasons and ways where you can break that cycle, take breaks, like just take a few steps around, walk around, sit for a while, again go back to standing. That is the one thing, standing. And then if you have symptoms, then there are certain devices, certain specialized stockings that you can use. So yeah, these are things
Yeah,
that can be
yeah.
done.
The reason I ask this question because a lot of people tend to confuse that standing is equal to movement, which it is not. I think
Yeah,
standing is
absolutely not.
just being stationary, so it can't be movement. You need to actually physically move to bring about some
Yeah.
changes in the dynamics of your body and make yourself in some kind of motion again. So, you spoke about wearing some kind of socks or cushion which will help you.
Stockings.
Yeah, stockings. Uh, how important is it in terms of footwear? Because, in my profession, let me tell you this, I stand for a long time every day, almost 8 to 9 hours every day. But I also make sure that I'm not stationary. I'm moving all places. But of late, one of the other things that I identified is that the nature or the quality of your footwear also has an impact on how you feel at the end of the day. So, for
Mm.
example, I had two pairs of shoes, and in one pair, I thought because the shoe was at a slightly heighted dimension, I could feel some pain at the end of the day. Whereas in the other shoes, which was much closer to the ground, and there was not much between the ground and where the foot per se landed on the shoe, I didn't feel that pain. So does the quality or the makeup of your shoe, does that also have an impact on how you feel at the end of the day?
Yeah, so the thing is, in terms of footwear, the one thing that you'll find is if you talk to 10 different doctors or experts in the field, you'll get 10 different opinions. So firstly, there is no consensus that exists in terms of footwear recommendations, number one. Number two is I personally believe that our foot, I mean, we have been God has given us feet which function in a certain way. Like our foot is made to function without shoes. I mean, our feet were not made to function with having shoes on. So when you pick your footwear or the shoes that you wear, firstly it should be made in such a way where it doesn't interfere with your foot mechanics. Because your foot is capable in itself to mechanically function through all your activities. So the first recommendation is don't. I mean, yeah, if you're doing something which involves running, or if you're into athletics, so if you're doing some kind of specific activity, then yes, you need specific shoes suited for that particular activity. But if you're someone who's uh, you know, going about your normal activity, having footwear, which so your footwear firstly should be cushioned, well cushioned, adequate cushioning. Again, as you said, it shouldn't be, cushioning shouldn't be too thick. Like you should not have a very thick layer because that again cuts off and interferes with your normal foot biomechanics. So you should allow your foot muscles, the arc of your foot, the ligaments at the sole of your foot to function normally. And when you let your foot function normally, you're going to have lesser problems. If your footwear is something that interferes with the normal functioning of foot, that is when problems start, especially if that accumulates over a period of years.
Yeah,
And again,
absolutely.
then there are specific recommendations. Like in certain cases, we would actually recommend someone to use footwear with a slightly raised heel as
Hmm.
such. That is specifically if you have some of our patients who have pain at the back of their heel. That is mainly when you have tendinitis or inflammation at your Achilles tendon. Achilles tendon is the tendon that attaches to the back of your heel, which arises from your calf muscle. So in those patients, we actually advise them to wear footwear which has a higher heel, which has a slight heel raise, because that relaxes your tendon. So again, it's very specific to what conditions you have. But in general, my recommendation, as a blanket recommendation for everyone, is always to choose footwear which doesn't interfere with the biomechanics of your foot, because your foot is capable of dealing with most routine activities.
Yeah, yeah, absolutely. And one of the other things which I've observed for myself is, you know, I do not wear a footwear when I'm not working. So, for example, when I'm at home,
Yeah,
I don't have the habit of wearing a pair of slippers or anything like that. I like the touch of my feet to the ground. The other thing I've tried to
absolutely.
practice quite often, because I love taking walks. After walking, I also do 10 to 15 minutes of what is called as earthing, where you walk on the tender grass, which has got the morning
Yeah.
dew, and that also tends to uh, give you a healing touch. So does that really have an impact on how your foot feels after walking on the grass? And if yes, what really happens there?
So again, I think as I said, like the human body is designed in a certain way. Our feet are designed in a certain way. Our foot has a number of tiny muscles. It has a lot of ligaments. Our foot has an arc. It has a very, very specific design, and that is made to function without shoes. Yeah. So, having that and giving your feet exercising bare feet, or rather walking for certain other day bare feet, is, I feel, definitely there are benefits to that.
Yeah. Perfect. Now, you have in the arena of sports, you call yourself a sports orthopedics, or you're someone who has been working very, very closely with people who have been pursuing sport as an activity, and you've been dealing with their problems. I would like to know from you, to what extent one should incorporate sports in their life in terms of keeping themselves healthy. Because a lot of people that I have seen do not do any kind of exercise, but they are into physical activity. Specifically, they would play lawn tennis or go for a Sunday cricket match, or someone would love to go for
Mhm.
swimming. So, can sports be a good substitute if someone doesn't love to do exercise per se?
Yeah, absolutely. I mean, I'm a big fan of sports as part of your lifestyle. Uh, I think on a cultural level, on a social level, we don't value sports as much. Like even when you're in school, sports is always optional. Like your academics always takes precedence, and parents always push their kids to do well in academics, to engage, give most of their attention towards academics. Sports is generally very selective. It's only if you're really good at a sport and you feel that a kid is has the potential to really make it choose a particular sport as his career. Only then he's encouraged to pursue sports. But what I personally believe is every kid should, in at right from school, kids should learn how to. I mean, they should be trained in sports. And secondly, throughout your life, I think you should try and pursue two or three sports. When I say pursue, I mean you should try and keep getting better at it. So this can be just leisure. This can be just playing with your friends over the weekend and stuff like that. But Over and above recreation, I think everyone should pick one or two particular sports and try and get better. Like last the previous week, if you performed at a certain level, the next week try and get better at it. Just pick one sport for that matter, something that you like, something that interests you, because what that does is, so the thing about sports is, apart from the physical exercise that you get, especially in terms of team sports, there is so much that you can learn from sports, like it's about how to work in a team, especially in team sports. It's about learning how to deal with failures, learning how to adapt with your other teammates. So there are lots of other things apart from the physical benefit that you get from sports.
Yeah. And I think a lot of youngsters these days are taking up sports like pickleball and badminton, which is a good change to see. Unfortunately,
Yeah.
though, that we are also constrained for a lot of space around us, and therefore I think one needs to find a way to keep oneself active in the world of sports. But I think even cycling and swimming, which is highly underestimated by a lot of people, but you get to see a lot of people in their late 70s and 80s also who have been
Yeah.
cycling for about 50, 60 years now, and they enjoy doing it, both as a sports and as a mental recreation in some way or the other.
Yeah, so having said that, the thing is, I mean, if we off lately, I feel there's a lot of we are doing really well in terms of sports infrastructure. Like there are lots of independent turfs, independent sporting arenas which are coming up. Like even in our side of town, even in Kalyan, if you look, there are lots of turfs around which are doing really well. Like they have fairly good, fairly they maintain the quality of the infrastructure quite well. So this is picking up. Like in today's time, if you want to play a certain sport, if you can find the right company, you will. There are places around which where you can get the necessary infrastructure. You can rent out equipments and stuff like that. So it is getting much easier, which is a very good sign. So yeah, I mean, it's getting better. So there are lots of people who are getting to sports, lots of people who are doing it at a recreation level. Also, things are getting much better for kids who are looking at pursuing sports professionally. So yeah, that I mean, this is what I get from patients who come to me.
Yeah.
I mean, when I hear about the facilities that they have and all, these are things we didn't have when we were kids, when we were in school. So it's looking good in terms of infrastructure wise, the facilities that are available today.
Absolutely. Very true. Apart from this, on a humorous side, a lot of people play the adventure sport of getting in and out of the local trains every day. That doesn't count here. You actually need to
Yeah,
pursue some hobby which will keep you motivated and you love doing it. There is no mental pressure while you're doing it. Now,
yeah, yeah, exactly.
coming back to this whole idea of being healthy. Unfortunately, in any profession, and I've spoken to so many doctors about this, people who are diabetologists, people who are specialists in different areas, you see that a lot of patients are getting younger and younger. I mean, you talked about diabetes at a time of people getting it when they were in late 40s, early 50s, maybe. But now there is no particular age for it. You talk about
Yeah.
hypertension, the same thing, and many other diseases. Do you see that also happening a lot in your profession? And if yes, what do you think is causing it?
Yeah, so in terms of as I said, the whole thing about having sedentary lifestyle, having a lack of exercise is definitely taking a toll. So you find a lot of younger patients coming in with backaches, neck pain, multiple spine issues and stuff like that. But these are really things that can be fixed easily. You just need a few lifestyle changes. You just need to get them exercising, and most often than not, these are things that are corrected. Uh, in terms of more serious conditions like arthritis, I think what has happened is I mean, in the recent years, uh, I mean, longevity has increased. We are living much longer, so people are now living into much later years, where disease like arthritis and all have now got the time to start getting manifested. So I think that is the reason why geriatric health issues are now getting into focus, because we have a huge bulk of uh, geriatric population now in our society, and their issues are kind of things that need to be addressed.
Yeah, absolutely. One of the other things which I observed with my grandparents, to be honest with you, is that we never had a
Mm.
dining table. So people used to have the lunch and dinner sitting on the ground along with the
Yeah,
entire family. But these days, I think there are so many other things around us in terms of upgrading our lifestyle. Like, for example, we have dining tables. We often use the chairs for anything that we do, whether it's reading or even cutting vegetables. So do you think
yeah.
things like that also have made it slightly more difficult for us to be in sync with doing natural stuff? And because of which it's kind of aggravating all these problems?
I'm not really sure. Like, I know that there is a school of thought which thinks this way, but I don't think so, because if you look at say the Western world, they don't have. I mean, for the longest time they haven't had this culture of sitting on the floor, and they've sat on tables and chairs, but they tend to be a lot healthier in terms of musculoskeletal health, at least. They might have a different set of problems, but in terms of musculoskeletal health, Caucasians, Westerners tend to do fairly well as compared to us Indians. So I think it's a matter of getting a certain amount of firstly exercise in a day, and it can be in any form. It can be in the form of walking, can be in the form of engaging in some kind of activity, some kind of exercise. So it doesn't necessarily have to be, sitting on the floor or sit. I don't think that. I mean, this is my personal opinion. I don't think that
Sure, sure.
has a great impact.
So not a huge difference maker. Maybe a little bit of
Yeah,
movement, but not a huge difference maker is what you feel.
yeah.
So I'm going to revisit this question about the exposure to the sun. Interestingly, I was
Mhm.
listening to one of the other podcasts by a doctor, and he said that it's not only about the exposure to the sun, which talks about the vitamin D factor, but also what time of the day you get that exposure and for how long. Because as you age,
Yeah.
the absorption from your body kind of reduces, and that also is a factor that
Mhm.
plays an important role. What's your take on this?
Yeah, so firstly, it's about the time of the day. That is, early morning sun exposure is what is recommended, number one. Number two is you have to get enough of hours of exposure, which is not always possible. Now, there is again no consensus on the exact number of hours which is required to maintain vitamin D. But in today's lifestyle, I mean, we're not out in the sun for too long, especially not everyone is able to do that in the early hours of the day. And thirdly, it's about the amount of your skin that is exposed. Now, the way we are dressed and the way we are clothed when we are out, we hardly have any amount of skin exposed. So it's just a face. If you're wearing short sleeves, some part of our arms. That is not enough, even if you're in the sun the whole day. But if you have only your face and some part of your neck and your forearms, forearms down exposed to the sun, that is not enough of area of skin exposure, to get enough of vitamin D. So yeah, that is that there is. I'm not sure how we are able to how what is required for us to correct that. But yeah, that is a major issue
Yeah, yeah. Maybe,
in terms of
as you
exposure.
said, spending more time in the sun consciously could be
Yeah.
something that we can consider in terms of getting more exposure.
So if it's not something you can do every day, maybe something over the weekend, when you so the thing is, what people can do is over the weekend try and pick your leisure activities where you're spending more time outside, as opposed to, especially in the early hours of the day, try and move out, just go somewhere, go for a short picnic. Or I mean, the problem is in cities like ours, there's not a lot of not a lot of stuff we can do outside. But that is the one thing you can do, to try and figure out some kind of leisure activity where you're out in the sun, especially during the early hours of the day.
Yeah. The more we talk, I'm getting convinced that most of these things are kind of intertwined, isn't it? You talk about movement, you talk about sports, exposure to the sun. So invariably, all of these are connected in some way or the other. I mean, if you play a sport, you're also getting exposure to the sun, you're also getting movement, you're also getting that mental relaxation that you're looking for. So in a way, these are not different parts, but they're parts of a whole that we need to look at.
Exactly, and I think a lot of times there's one thing that we neglect is social exposure. Like what, as I said, I'm a big fan of team sports. I mean, see, the thing is, right now in my current situation, I don't get a lot of time to exercise, to take care of my health. Honestly, that is something that I'm looking to change at a personal level. So if and when I get time, let's say I have 2 hours in the whole week where I have the choice to do something, I would definitely go out and play some kind of team sports activity. Because apart from the physical activity, the exercise that you get, it's also that social, that's social exercise that you're getting, where you're going and interacting with people, you're meeting people, that is something also which we need to neglect, which is part of maintaining a good healthy lifestyle, and that is what team
Absolutely.
sports do.
Yes, the more time you spend with your colleagues, with your friends, with your family members, I think that is something which gives you a lot of mental boost, often
Yeah,
underestimated. And I think we are seeing evidences of that in the Western, part of the world, where a lot of people are suffering from insomnia and loneliness, in spite of having
yeah, yeah.
great physical infrastructure around. Is that you need that social infrastructure, the social fabric that actually connects one human being with the other.
Yeah, like I said, see, it's my ideology is very simple. The thing is, you should work with your strengths, and the strength that we have right now in our Indian society is we still have a very good, robust social system, which the Western world has denounced, or they don't have it based on whatever path they have chosen to take. We still have that, and we are losing it. But if we are conscious about the fact that this is our strength, having this good robust social structure where we have family, we have extended family, that is around us, we have this sense of community. So yeah, these are some things that these are our strengths, honestly speaking. So if these are something that we can work with, again, it's about making minimal changes. These are simple things that we can do. So you already have this in your system. It's just about going out and accessing it.
Exactly. Very true. Doctor, I would like to ask you, in your experience for the past 10 plus years now that you've been practicing, was there a case which was kind of complicated or challenged your expertise, uh, and finally you're able to crack it and you felt a greater sense of relief and relaxation? In every profession, there are certain situations which, when you look back at them, you really feel excited and proud, as if you're living it today. So, has there been any such case that you'd like to talk about?
Yeah, so there have been quite a few, but the one that kind of comes to my mind right now is so there was this was the time when I was working in Gujarat. I was
Mhm.
working at the charitable hospital, and there was a young girl, lady, I would say. She was married. She had a kid, very young kid. She had a cancer in the lower part of her leg bone, the upper part of her leg bone, that is just below her knee. And she had gone to multiple places and she had sought some kind of treatment, but she had reached a point where she needed surgery. And the family didn't have the finances to take care of the surgery, and the surgery is extensive. Like it is something that involves a multidisciplinary team. Like it involved me as the orthopedic surgeon. I had to involve an oncologist. We had to get a plastic surgeon involved. There were multiple procedures involved. It was not just one single stage surgery, but we were able to do that. Firstly, the thing is, so it was not just my expertise or my experience and my knowledge. I think what I'm really proud of is the way I was able to, get all these people together to make it work. We had to get in touch with the hospital management. We had to get in touch with the trustees to organize the finances, because this particular surgery required finances to be arranged over and above what the patient was capable of. So we kind of, and everyone was very helpful. We kind of were able to do that. We had to call in a senior oncosurgeon who doesn't always come there for surgeries, but he was kind enough to give him. He's a very senior surgeon, but he was kind enough to give his time, move. And he wasn't practicing in that city itself, so he came from another city especially for this procedure. Then we had a plastic surgeon come in from another city. So I was working in a relatively smaller town, but what I'm proud of is not the fact that I could organize all this for the patient. Uh, what I'm proud of is the way how people responded. Like
Yeah.
when I went to the management, I told them that there's a fight. They absolutely and immediately were willing to help. They pooled in all their resources. They made the necessary arrangements, and they did that. When I approached the senior oncosurgeon, he was kind enough, and he said, "Absolutely, we'll do it." And he gave in his time and all that. So I'm just saying that it is people want to help. There are people out there who are ever willing to help. So it's just about reaching out to people and kind of taking the effort to organize such things, and you can do amazing things because there are people out there who are willing to help.
True. And it also talks about the tenets of teamwork that you've been harping so strongly since the
Yeah,
last
yeah,
few minutes, is that you got to get the right people and make sure that they all work together when it comes to helping the patient, right? Doctor,
yeah. So this is yeah, sorry. So the since you said teamwork, this is the one thing that lately in my practice, this is something that I have started. I'm with every passing day and as time goes by, this is something that I've realized that in today's system and the system that we have in India, teamwork is absolutely important, in terms of providing good care for the patient. Like for example, as I said, I work with a lot of sportsmen. I do a lot of sports injuries. So, in terms of athletes, when an athlete comes with let's say, for example, an ACL tear, getting him back to his sporting activity requires teamwork.
yeah,
So now this team includes me, the surgeon. It includes the physiotherapist. It includes his sports nutritionist. It includes his specific coaching team, which is very specific to his sporting activity. It includes again all the paramedical people around getting things organized, getting the stuff done, getting the surgery done. So only if the problem is in right now in Kalyan and in most parts of Bombay, even in most parts of Bombay, there is no one-stop solution for all of this.
yeah.
There are very few actually centers which have all of this under one roof. In Kalyan, definitely we don't have that. So it's about, organizing everything for this patient and, working as a team, even though you're not in one space or you're not working under one roof, still working together. And it's interesting because I'm meeting a lot of new people. I'm working with a lot of, people from allied disciplines of medicine and paramedical fraternities. But it's great because we are able to work and we're able to give results. So it's very refreshing. It's very encouraging to see that.
Excellent. Just like the bones in our body work together in tandem to provide us movement, I
Yeah,
think it's equally important for us healthcare professionals to be able to work together as a unit and to deliver world-class services to our patients as well. Okay,
yeah.
so as we come to the last section of our discussion, Doctor, a few more questions. Uh, are there any specific books that you'd like to recommend for people in general to up their skill sets when it comes to taking care of themselves and their family members?
So I honestly I haven't come across any such book that that could be the one book that you read and you get the answers to all your questions. But I think more than books, I think it's about. I mean, the one thing that I always recommend people is to start uh, talking to experts.
Hmm.
Like for example, when someone comes in, like for example, athletes. When athletes come and ask me about, for example, someone who's post injury and now they're trying to get back to their sport. So I ask them to go to strength and training coaches to go to now for specific sports there are experts available, and even in Bombay and around Bombay we have a lot of people who are trained for these specific things. So I always I never shy away from directing people from going and contacting experts, and experts are there. And in today's time, if you are not going and meeting these experts, you're losing out. So, for example, in terms of when someone comes to me and asks me for dietary advice, I do give them advice from my end. But at the end, I also say go and meet a nutritionist, go and meet a dietitian, because the level of advice and the level of detail that they will be able to go into with you and the results that they will be able to give you are nowhere close to what I can do. So, the one habit that we don't have culturally is to get access to these experts, and we have experts available in every field and in every nuance, detail of healthcare. So I think people should get access to these kind of experts, who are available.
Absolutely. Seek expert advice because experts know
Yeah.
the best of insights that they can share with you, and that can definitely up your ante and make sure that you're on top notch of your game. So, one last
Mhm.
question, Doctor. What are the top three recommendations or suggestions you would like to give to people in general, given the fact that most of us today are victims of lifestyle diseases? What are the top three recommendations you'd like to suggest people to follow in general?
Yeah. So, so actually, these are recommendations that I should be following myself, because uh, the hectic lifestyle is starting to take a toll on me too. So, and I'm starting to realize that. So the one thing that I would tell all my patients and friends, family, everyone included, is start taking breaks for yourself.
Mm,
The stress of professional life, the pursuit of trying to excel, trying to get better, trying to make more money is always going to be there. It's never going to
yes.
end. But every now and then, start taking breaks. These breaks can be in any form. Like there are people, everyone has their own way of relaxing. For someone, it might be a vacation. For someone, it might just be taking a couple of days off, staying back at home, relaxing. It might be, a different kind of activity for everyone, but start taking breaks. It's not just for your physical health. Also, it's very important for your mental health, and from taking a break from the stress.
Yes.
That is the one thing that I am trying to do at a personal level, and this is something that I recommend to everyone. Secondly, it's trying to get in more hours of exercise. So when I say exercise, I don't mean, it might not necessarily mean going to the gym. So it can be, again, uh, my recommendations are always minimal modification in your already existing lifestyle. So for example, what I try to do is I try to avoid taking the lift, try to use the stairs. If I have to travel from one place to another, and if the place is walkable, I try and walk if time permits,
Right.
rather than taking transport or driving. So these are few things, simple things that you can do, but it has to be a conscious effort. If you're not aware, and if you're not consciously trying to do it, you will not be able to do that. So these are the two things. And secondly, secondly, diet.
Yeah.
Like, diet is something. The problem is, in today's the way we function right now, we don't necessarily have control over all our meals, in the sense, like, for example, even me, I probably have breakfast at home. Then my lunch is the time at which I have lunch is very varied. It completely depends on my unpredictable, routines. Sometimes there are times I skip lunch. There are times I have to eat out. There are
Yeah.
times I have to eat at the hospital. So you don't always have control over all your meals in a day. So the one thing that you can do is recognize the meal that you have control over. Like, for example, if you know that you're someone who has breakfast at home every day, so that is a meal now you have control over. So try and load in most of your nutrients in that meal. So at least you're sure that you're getting your nutrients packed in that one meal. So even if you skip your lunch, or or you grab a small meal for lunch and all, you're still getting in your nutrients, because you know that you've had a solid breakfast.
Yeah.
And it might be different for everyone, but try and identify the things that you have control over and start working with them. And the things that you don't have control over, that is, there's very little you can do with that.
Well said. Well said. Thank you so much, Doctor. That was some very, very nice suggestion and opinion out there. Really appreciate the time that you took today to help all our viewers in terms of understanding how should they take care of their body, their health, especially in terms of the lifestyle that they're all living in. So really appreciate your time today. Thank you once again, and we'll definitely invite you again on the show whenever we require more suggestions and recommendations from your side. Really appreciate your time
Sure,
today.
sure. And I would like to thank you. I mean, I think we met quite a few months ago, and
Yeah.
you had proposed this idea to me, and obviously I was always keen to do this. And the reason we are doing this right now is because a week ago, or a couple of weeks ago, you again, you met me, you proposed the idea, and then you pushed. So I'm the kind of person who needs that push, and you were persistent enough to push and to follow up, and that's why we're doing this. So yeah, I
Pleasure.
mean, it was really fun doing this, and yeah, I would definitely
Pleasure.
love to do it again.
Sure. Thank you.
So
Thank you
thanks,
so
thanks a
much.
lot. Thanks for having me.
Thank you. Bye.